association with all lobular structures and often goes in between the small ductules as well. And these are fibroblasts, these are elongated nuclei. And in cancer, there's crosstalk between the stroma and the epithelial cells. And so you're familiar with that.
And,
so what else?
What's this stuff in here? What's this pink stuff? Does everybody know?
Actually, no.
Collagen. So that's the material is laid down.
Sort of
by
collagenous
fibroblasts.
fibrils, right?
Right.
So that's sort of what it looks like when it's cut in this two-dimensional structure.
How about the pink dots, red?
Wow, good
This?
question. What do you think they are?
Yeah, I did.
You said it. What are they? What color?
Pink
Or
Pink.
or red?
Blood.
Blood.
Yeah,
Exactly.
those are blood cells. Those are red cells, erythrocytes, red blood cells. And down here you can actually see a couple of small vessels. A little vessel, and they each have a little bit of blood in them.
Yeah.
When you cut the tissue, the blood vessels drain out because they're open tubes. So often you don't see a whole lot of. In life, this will be totally packed with red cells.
Sorry, what are the cells inside the duct? It's like
Inside the duct,
yeah, like,
Like
right
in here.
yeah.
Okay, so let's take this one. So there are two main layers of cells. There are this inner layers of cells here. Those are the epithelial cells. And there's an outer layer of cells that are a little bit more elongated. Those are the myoepithelial cells.
So can you see that? Like here, 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 you know? Like those are the...
I have a better picture.
Yeah,
of the
we'll get
coming
to it in a
actually,
minute.
but-
Yeah.
But that's true for the lobules have two layers of cells, and there should be a little bit of an opening in the center of these structures is normal. If it's not there, then something is going on that's not totally normal, and we'll look at that as well as we go forward.
There'll be a lot more.
There will be a lot more of this. And the other thing is that there's lots of variability, and I'll show you some more examples of what's normal, and they don't all look exactly the same, because there is variability between people. So this
Britt has agreed, by the way. Just, I'm not being rude. That
No,
that I can keep interrupting her and vice versa
Oh, I
because
will keep-
you know it'll be a tag team. So, but are you going? But Britt has in mind what she's going to say, and she's got a bunch of slides. So if I ask
Yeah.
if she's going to, it's because we haven't given the talk to each other. But what about this? You know, the artifact that we're
Oh,
seeing.
okay.
Do you want to like
All right, so
mention
there are
that?
empty spaces here, right? You know, it's all right. In normal situation in life, there are no empty spaces. Everything is up against each other like that. Although there are openings in the center of the ductals, but there's secretion of milk would come into this and be transported to the nipple under circumstances when you're lactating. But this is an artifact, actually, because what happens to the tissue is the comes fresh from the operating room. But in order to cut it, you have to fix it. So the specimen is put into formalin, and then it's embedded, and then we cut those 4 millimeter pieces out of the specimen. And then those are embedded into paraffin. So they're hardened, and they sit in a little rectangle of
Cassette. Of
a
wax.
cassette with wax, and then you cut a 5 micron section from that, and you float it on a water bath, because you can't handle it in any other way. They're just very delicate. And then you stick a slide underneath it and pick it up. So you have then paraffin and a very thin slice of tissue. And then you put that through a staining process with hematoxin and eosin, which is pink and purple. So you get purple mostly in the nuclei of the cells, and you get pink in the background. But part of the process when you go through all this handling of the tissue is that you get shrinkage artifacts. So things that used to be together shrink a little bit, so you get gaps like between the duct and the surrounding stromal tissue. And so that's something that we expect to see. And when I look at a slide, I don't even think about it, and it's good that you brought it up, because to me, I'm so used to this artifact. And when we look at tissue, we really are looking at a bunch of artifacts that we have learned what they mean. It's really all actually
Reproducible,
artifacts.
in fact. So
It's a
that
reproducible artifact that we have empirically learned what they mean. Yes.
Okay, I actually have two questions. So you talked about the pink stuff being collagen. Of all the matrix proteins present in breast, does that represent also fibronectin or laminin, or does that not show up, or does it show up?
You can't tell them apart. It's all
So
there.
it's all the same. So it's not just collagen.
Right.
It's just matrix protein.
Matrix
And
protein,
it's all that
all in
combination.
there. And you know, as pathologists, historically, we have no clue there was all this stuff in there. But we can have stains that stains collagen, and we know
Right.
that if you put that stain on there, it will light up. But there's
Okay.
other things
But that's
in there too.
ECM, more
Right.
more accurately. That's
exactly.
Yeah.
Okay.
Exactly.
And so when you look at a cartoon, you've got of a duct, you have the luminal layer and you have the myoepithelial layer.
Mhm.
And if you had a section that was cut really clean, sometimes you see that very well, like a luminal layer and a myoep layer.
Right, and I
And
have a
what we
picture of that coming up.
Right. So, but what we see most of the time, like that major duct,
Yeah, or just
they're
look at-
all really messy, right? So
It's
how do
total
you
mess.
know?
It's a total mess.
It's exactly. So, I mean, I understand, we understand all the cartoons, like this is what a normal looks like, and then DCIS and all this, but
Yeah.
how do you tell?
Because it's cut like this.
Right, but how do you tell if it's
Well,
cut a certain way?
Because
or
you and I,
if it's
it looks like a
pathology?
mess, but in fact, Britt has trained her eyes over 20 years of looking at this.
I know
So
that
that
this
she-
is only one layer. It's
She can see
tangentially cut,
Okay.
so it piles up a little bit, but it's within normal limits. So I know this is normal.
Can I get a sense of who's a lab scientist, a wet scientist in the room? Can we just have a show of hands? So really only a couple of you, and the rest are either scientists or not, or advocates or something like that. So if we talk about stuff, or at Berkeley as well, then you'll excuse us if we sort of get too elemental, but keep asking us questions.
Okay.
Sorry.
So here this looks entirely different, but this is also a normal breast. But for those of you who have been pregnant, this is what happens during pregnancy, late pregnancy, when you're just getting ready to lactate. So there is enormous proliferation, growth of the epithelial component of the breast. And instead of, most lobules, instead of being this small, become much more prominent. And they're now back to back, and there's very little stroma in between. And, the breast is enlarged in this process, and it's a reflection of all this activity that's going on. And you can see how dilated some of these spaces are. If we go to the next picture, you'll see a high power view of breast epithelium that is secretory, is now producing milk, which is released into this space and then transported through the duct system to the milk. So these cells look very different from the quiescent breast that's not lactating, but this is also a normal picture of the breast. All right, so since I'm what I do for a living is cytology, and I do a lot of fine needle aspiration biopsy. So besides, you can sample the breast in different ways. So what we talked about so far is when you have a piece of tissue that has been removed by surgery, and you take a piece of that and embed it into paraffin and cut it. And you see such an example here in the background. And for instance, here you can see the ductule happened to be cut, so you can see it leading into this particular lobule here. So this is taken under much lower magnification, so you see it more at a distance. And here there's a larger duct, for example. And needles are projected on top of this. This is a 23 gauge needle, and this is what we use most of the time for fine needle sampling. And what we do is enforce this needle forward through the tissue. And the fibers, this particular example has a lot of the mesenchymal stromal component in it. And that's very difficult to remove with a needle, but the epithelial component is much less attached and will come out easier. So it's enriched in the fine needle biopsies. And the biopsy needle is wide enough that you can get a whole lobule out. And that's